morning, sir. May I come in?
Yes, hi.
Thank you. Come in, I perform hand hygiene, and I put on clean gloves. Good morning, sir. My name's Kev. I'll be your nurse today. Can you tell me your first and last name and your date of birth?
Kenneth Dexter, 8/27/69.
Perfect, thank you. And can you let me know if you have any allergies?
Yes, actually, I'm allergic to those gloves,
Okay.
Latex.
Latex?
Gloves,
And
yeah.
what happens when you come in contact with it?
Yeah, I get a little rash sometimes.
Okay.
You know.
Let me just check your wristband. I'm making sure that your name, your date of birth, and the allergies match against the chart, and I verified it, and they do. All right, Mr. Dexter, I'm going to do a head-to-toe assessment on you real quick. This will just help us get a baseline to see how your body's currently functioning.
Okay.
This should take less than 20 minutes. Do you have any questions before I start?
No.
All right, so first let me just ask you, can you tell me today's date?
It is it's the 18th, I believe, of November.
And what year?
23.
And can you tell me where you are currently?
So I'm in the hospital.
Okay, perfect. So your patient is oriented to person, time, and place. And then looking at you as I'm going along your alert, you respond appropriately to conversation. I don't see any involuntary movements. Your dress and grooming is appropriate for the location and the season. And could you tell me, sir, if you're in any pain currently?
No. Okay. It's just, I have a little bit of a headache.
Okay.
It's kind of, I get that.
And when would you say that this started?
So it's the last day or two, I had a headache kind of off and on.
Okay.
Take a Tylenol for it here and there.
Okay. How would you describe it? Like throbbing, dull?
Dull. That's
Dull.
a good word for it.
Okay. Does anything seem to make it worse?
Unfortunately, when I move around too much.
Okay.
Like activity.
And does anything seem to make it better?
When I'm resting. When I
Gotcha.
get off of activity.
And you mentioned it kind of comes and goes off and on.
Yeah. Yes, it does.
And you mentioned that you take ibuprofen. You've been taking ibuprofen to treat
Yeah,
it?
that and a Tylenol.
Okay. And on a scale of 0 to 10, with 0 being no pain, 10 being the worst pain ever, how would you rate that?
It doesn't get much more than, say, a 5 or a 6.
Okay.
Really.
Keep that in mind. All right, sir, I'm going to go ahead and ask you a few questions, okay?
Okay.
So first, have you noticed any changes to any moles that you may have?
No. No changes in.
Have you noticed any itching at all?
No.
Any excessive bruising or rashes or lesions?
No.
Have you noticed any hair loss?
No.
Have you noticed any changes in your vision?
No.
Have you had any recurrent earaches or ear infections?
No.
Any ringing in your ears?
No.
Any vertigo or balance issues? Do you have a sore throat currently?
No.
Do you have any recurrent nosebleeds? Any difficulty swallowing? Any mouth or throat lesions?
No.
Any nasal congestion? And then have you noticed any frequent or recurring coughs? Any recent shortness of breath? Do you have a history of respiratory infections?
No.
Do you have any difficulty breathing? Any pain while breathing, any chest pain while breathing, or any chest pain in general?
No.
And do you smoke? Any environmental exposures?
No.
Okay.
No.
Have you noticed any kind of blue or whitish areas on your body at all?
No.
Have you noticed any swelling anywhere? Do you have any past cardiac history?
Heart? No.
Any recent fatigue? Have you noticed any changes in your bowel habits recently?
No, not really.
Do you currently have any abdominal pain? Any recent nausea or vomiting?
No, definitely not.
Any past abdominal issues?
No, nothing.
And can you recall what you've eaten in the last 24 hours, just as best as you can describe it? You don't have
4 hours. Yeah, dinner. We had sandwiches, and it's more unusual, like breakfast and like a bagel or something.
Okay.
I think it was a bagel or a muffin this morning, and then some stew.
Okay. Have you noticed any? Have you seen that you've had to get up at night to go to the bathroom frequently to urinate specifically? Have you had any difficulty starting a urination stream? Have you noticed any changes in how frequently you have to urinate?
No.
Have Have you noticed any changes in your urine's color or odor? Do you have a history of any kidney or bladder issues?
No.
And then last set of questions. Have you noticed any joint pain or stiffness?
No.
Any muscle pain or weakness? Do you have any have you broken a bone before?
No.
And do you use anything like a cane or a walker or crutches to move around?
No devices, no.
Okay. All right, that'll do it for my questions. I'm going to go ahead and start my assessment. So first,
Okay.
I'm looking at your skin. I'm not seeing any skin breakdown, so everything is intact. I'm going to roll up your sleeves. Yep, and then I'm checking your legs as well. No skin breakdown anywhere. I'm going to feel for moisture. So skin's dry, but not excessively dry. And I also felt the temperature there as well. It's warm and equal bilaterally, nice and dry. And then on your lower extremities, a little bit more moist in the lower extremities, but still warm and equal bilaterally. I'm going to go ahead and check your skin's turgor, nice and elastic. And I'm not seeing any wounds anywhere, no lesions. I'm not seeing any redness, any swelling. I don't see any devices or lines in you. Checking your hair, it's evenly distributed, no discoloration anywhere. Feeling it, it's soft, it's not brittle at all. Checking your scalp, no bulging masses, no redness anywhere, no breakdown. And then moving along, I'm going to go ahead and check your eyes. So looking at the external eyes, I'm not seeing any discharge anywhere. And then if you could actually pull down,
like that?
yeah, just so I can see under your eyelids. Perfect. No discoloration in the conjunctiva. The sclera is nice and white. And then you can go ahead and let go.
Mm-hmm.
And I'm going to go ahead and shine this light in your eyes, okay?
Okay.
All right, and then I'm going to go ahead and have you focus on, I'm not going to shine it at you, I'm going to have you focus on this pen light. I'm just going to move it towards you and then pull it away, okay?
Okay.
And you just focus on it. All right, pupils are equal, round, and reactive to light and accommodate. I'm going to go ahead and check in your nose.
Okay.
If my pen light will work. No discharge coming from your nose. I didn't see any discoloration anywhere. And then if you could open your mouth for me, I'm going to check for some lesions. Checking in there, no lesions, no discoloration. And if you can lift your tongue up for me. Very good. Features are symmetrical. No venous discoloration. And then next, I'm going to go ahead and check your nails actually. And nice and smooth, no clubbing. And then I'm going to go ahead and check your capillary refill while I'm at it. Alright, cap refill was less than 3 seconds in all extremities. Alright, so looking at your breathing, I've been noticing your breathing pattern's been regular. It doesn't look like your breathing is labored at all. I'm not seeing any accessory muscle use. Your chest expansion is symmetric.
Mm-hmm.
And I'm going to go ahead and take a listen to your lungs.
Okay.
If you could just lift your shirt up, you don't have to take it off. Just
Sure.
go. And then you can just go ahead and take normal breaths.
All right.
Okay?
Mm-hmm.
Alright, I didn't hear any adventitious sounds. The sounds were clear to auscultation when I was listening to it and present in all areas. And then so I'm going to go ahead and I'm checking your extremities. I'm not seeing any swelling anywhere.
Mm-hmm.
I already checked your capillary refill. I'm going to go ahead and feel for your carotid artery.
Okay.
Okay, feel it. Not feeling any thrills, and I'm going to feel on the other side. Okay, no thrills on the other side either. I'm going to go ahead and listen to your carotid.
Okay.
So what I'm going to have you do actually, I'll have you take a deep breath in, let it all out, and then hold it, okay?
Okay.
And then again for the other side, take a deep breath in.
And let it out and
Yep.
just stay? Okay.
Yep. Deep breath in, and let it out, and hold it. Perfect, no bruise. And then I'm going to go ahead and feel some of your pulses. I'm going to actually feel your radial pulses real quick. Okay, both are present. 2+ amplitude, so it's not too weak and not too pulsating either. I'm actually going to go ahead and get the rate for your pulse here. Right, so I got a rate of 72 beats per minute, which is within a normal range. Again, like I said earlier, the rhythm was regular, which is good. I'm going to go ahead and feel for the pulses in your foot now. Okay, you can feel it there. And I can feel it there. And sir, if you could take your shirt off for me, I'm going to go ahead and listen to your heart sounds. This will just make it easier for me to do.
Okay, take it all the way off?
Yep, yes
All right,
please.
sounds good. All right, here you go.
Alright, so first I'm going to listen in the aortic area, which is the second intercostal space, right sternal border.
Okay.
Then moving to pulmonic area, second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. Tricuspid area, fourth intercostal space, left sternal border. And mitral area, fifth intercostal space, midclavicular line. Okay, and I'm going to go ahead and listen with the other side of my stethoscope now. I heard S1, S2 heart sounds, no extra sounds or murmurs, which is good. And sorry, I'm going to backtrack to one other part of my assessment that I missed. Could I have you make some faces for me? Could you smile? And then could you frown? And then could you squint your eyes really, really tight? Perfect. And I'm going to go ahead and move into an abdominal assessment. I'm going to have you keep your shirt off.
Okay.
I will have made sure that you voided beforehand. So looking at your abdomen, I'm not seeing any pulsations, no bulging masses, no venous discoloration, no redness. I'm going to go ahead and listen now.
Okay.
Alright, bowel sounds present in all 4 quadrants, and if I didn't hear anything, I would listen in each quadrant for 5 minutes. So I'm going to go ahead and listen to the aortic area real quick. Didn't hear anything, which is good.
Mm-hmm.
And then I'm going to go ahead and feel around your abdomen. I'm going to start with a light touch, and then I'm going to kind of go deeper, okay?
Okay. Sounds good.
I'm going to start with a light touch. As I'm feeling, there are no masses, no tenderness. Patient isn't guarding. And I'm going to go ahead and move into my deeper touch, okay?
Okay.
Same as before, no masses that can be felt. Perfect. All right, so you can go ahead and put your shirt back on, and I'm going to go ahead and retract this just a bit.
All right.
And then, so I would also monitor the patient's intake and output. And then last, I'm going to check your musculoskeletal system, okay? Because we're going to I'm going to test your range of motion, and I'm going to test your strength.
Sounds good.
And then I'll go ahead and have you stand up for me
All
whenever
right.
you're ready.
Sounds good. Sure.
All right, so first we'll start with, you can actually stand here.
All right.
Yep, just kind of mimic my movements if you can. So first,
Okay.
we're going to start with the head. I'm going to have you touch your chin to your chest,
Okay.
and then extend your neck all the way back, like this. Very good. And then touch your ear to your right shoulder. Then touch your ear to your left shoulder. And then I'll have you rotate your head, have your chin over your right shoulder, and then over your left shoulder. Very good. And then next, I'm going to have you bend over as far as you can.
Okay. Straight down here.
Yep, straight down, perfect. And then extend your back all the way back as you can. And then kind of lean to your right side.
While I'm back here.
Or you can stand upright again, but
Okay.
lean to your right side,
Okay.
lean to your left side. All right, we're going to go ahead and test your shoulders now.
Okay.
So stand with your arms like this. Your palms will face behind you.
Okay.
So you can go ahead and start by putting, arms back like that.
Okay.
And then you'll kind of rotate them like this, raise it up to the sky,
Okay.
kind of have it cross like this. Very
Okay.
good. Kind of bend your elbows, put your hands behind your head.
Mm-hmm.
And then rotate around again, and you're going to put your arms behind your back.
Okay.
Very good. And then I'm actually going to have you lay down again because I'm going to test your ankles range of motion.
Okay.
So I'll just have you lay down
Go
again.
ahead. All right. Range of motion, you say?
Yes, sir. So
Okay.
first, I'll have you kind of pull your ankle back to have the toes facing up towards the ceiling. Very good. And then point them so the toes are facing the ground. And then flex so they're coming both so that they're coming in towards you.
Okay.
Very good. And then flex so that they're both away.
Mm-hmm.
And then go ahead and flex both sets of your toes. Very good. And then straighten them. Very good. All right.
Okay.
I didn't see any difficulty with you performing these activities, which is good. And then I'm going to go ahead and I'm going to put this back down.
Yes,
Actually,
sir.
I'm going to go ahead and test your strength now, okay?
Okay.
So I'm going to put my foot or my hand against your foot. Go ahead and press against it as hard as you can. Very good. 5+ strength. Same with the other foot. Very good. And then we're going to do it the opposite way. So
Okay.
you'll come back towards you against...
Toward me. Okay.
Yeah. Perfect. 5+ strength. Very good. I'm going to put this back down. We're going to test this with your legs, okay?
Okay.
So you'll extend your legs against my resistance, okay?
All right.
Whenever you're ready. Very good. 5+ strength. Other side. Very good. And then I'll go ahead and have you stand up.
Right.
So first, I'm going to have you flex your arm towards you.
Okay.
And I'm going to...
You resist it already?
Yep.
Okay.
Very good. And then we'll do this with your other arm. You can put it down like this.
Okay.
And then go ahead and pull. Very good. And you can flip your forearm over, and now you'll extend it against me, okay?
Here, and then try to go
Yeah.
out. Okay.
Very good.
Okay.
And then same with the other arm. Very good.
Okay.
And then you're going to go ahead and try and extend your shoulders
Arms
against my
upward.
resistance.
Okay.
Very good, sir. 5+
Alright.
strength. And then, excuse me, last I'll have you grip my fingers as hard as you can.
Okay.
There we go. Nice and tight, 5+ strength. Perfect. All right, sir, that's the end of my assessment. I'll go ahead and have you sit down again.
Okay.
I'll make sure that the bed is raised to the lowest setting, side rails are up, call lights within reach. Can I get you anything else, sir, before I go?
No, that'll do it.
All right, thank you for your time, sir. I'll be back in about 15 minutes to check on you, okay?
Okay.
Moving out, hand hygiene on the way out.